how much will I make as a group practice owner? So I don't really have a great answer for you. I know, I'm sorry, I'm supposed to be answering your questions and having all these brilliant, wonderful, smart ideas on the questions that you ask, but it varies so greatly. It's like asking how much do CEOs make of companies? It's like some CEOs make, $50 million a year and some CEOs make $50,000 a year. And so there's going to be a couple of things I want you to consider when you're looking at your compensation. First and foremost is, will you continue to see clients? That's a big consideration because you may bring in a significant amount of your income. You may bring in the bulk of the income, especially in the beginning if you're just starting out. So you will probably not see that great of an increase if you're starting out with maybe one or two clinicians. When you start to bump up at different levels, then you can start either one, making more money, or two, or both. I mean, I've seen it in both, see less people. So usually what starts to happen is you are a solo practitioner, you hire one or two people, you make about the same amount of money, then you start to get busier, and then you need to hire more people. Maybe you hire some admin staff and you're still not making, a significant more than you were. And then there becomes a point where your expenses stabilize, you've hired the staff that you need, your contractors or employees get full, and then you start going, wow, yes, I am seeing the fruits of my labor, which means I can either take a higher salary or I can see less people. Most of the time, people opt to see less people and take the same amount of salary because they've been accustomed to the salary that they're taking. They're used to it and they like it, and they can actually see less clients and put their time into building their practice. It really is going to depend on a number of factors. Again, do you have employees or do you have independent contractors? With employees, you generally offer better benefits, more benefits. That can be costly, but then you usually pay a little bit less. If you have contractors, you usually pay a little bit more, but you don't have as much in benefits. So you have to weigh out what that's going to cost you. When you have employees up front, sometimes that cost is a little greater. And one thing that I have learned in working with people who have employees is that you definitely want to have a little bit more of a cushion. You want to be able to cover your employees' costs for a period of time, 3 months, 6 months, whatever that looks like, because you have to pay them. And again, it depends on your structure. Not that I don't pay my contractors, but with my contractors, I pay them a percentage of what comes in. So if $10 comes in, they get a percentage of that. If $1 million come in, they get a percentage of that. And so it kind of makes it a little bit easier. But as we know, and we have talked about many times again, some people prefer contractors, some people prefer employees. Some states allow for contractors, some states don't. And so that's really going to be dependent upon, your individual circumstances. I think it's really important to feel valued as the group practice owner, both in your time, in your connection with your staff members, and in what you're paid. You want to make sure that you are not underpaying yourself, because there are a lot of responsibilities that come along with owning a group practice. Getting referrals, following up with paperwork, following up with your clinicians, onboarding, hiring, overseeing an office manager, a client care coordinator, and depending on how big your structure gets, you're going to be overseeing all of those people. Now, if you have really good systems in place, it won't feel overwhelming, but it doesn't matter. You need to feel appreciated, and you need to appreciate yourself in that process. Not only do you need to be appreciated by the people that are around you, your clients, the clients you serve, your staff members, but you need to appreciate yourself as the group practice owner. I'm going to give you a few more tips about running a group practice and paying yourself, but first I want to thank our sponsor, TherapyNotes. If you're looking for an electronic health record that really is amazing for group practices, I want you to check out TherapyNotes. I recommend them all the time for people for group practices because the reporting is so great. It's so good. It makes it so easy for me to track what I'm doing, what my clinicians are doing, what the practice is doing. And what's wonderful is they have rolled out their telehealth option for free with a subscription. So I definitely want you to check out TherapyNotes for your electronic health record. So going back to compensating yourself, you're also, depending on the structure of your business, not just going to be compensating yourself with your salary. You may have a salary. You might take distributions. You also are going to have benefits. 401k. Is your company going to be matching that? Insurance, some of the other like CEU benefits that you're offering your clinicians. So when you're looking at your compensation package, I don't want you just to look at the number amount, though that's a pretty important number. I also want you to look at all of the other benefits that you are going to have as a group practice owner. Maybe you don't want to see any clients and you just want to run the practice, and that's a benefit. It's a great benefit. Maybe you want to see a bunch of clients and you want to maintain a caseload of 15 or 20, and you want to really make sure that you're getting your income both from the clients that you're seeing and running the group practice and having a higher income. That sounds great too. So as always, I think if you watch my videos, I think it's really customizable to what you need, what you want as the group practice owner. But a good salary is one of the benefits of having a group practice. So I wish you luck in your process. I am here supporting you, running your private practice. I will see you soon, everyone. Take care. Bye.